We appreciate you staying with us. The growth of a new COVID-19 variant is sparking concerns, especially as the level of spread in Milwaukee County remains high. This has pushed the city's health department to reissue a mask advisory. The health department says with Omicron and new variants like BA.5, reinfections can happen within 4 to 6 weeks. Doctors say they are seeing people make a reasonable recovery within a few days, especially those who are vaccinated. So Dr. Jeff Pothof from UW Health joins us now for some new insight on the future of the pandemic response. Dr. Jeff, of course, we appreciate your time, always with us. Can we start talking about this BA.5 variant? I feel like a lot of people may just be confused about what variant does what, if one is stronger than the other. Of course, we've had several waves at this point. So how is this one different, and what new information do we have about this variant and how it operates?
Yeah, this BA.5 variant originally originated in Africa, and these viruses, especially the Omicron strain, they evolve. They get better at being viruses. Just like, we started with a horse and buggy, and now we have a Ferrari and a Maserati. The viruses do the same thing, and typically they do two things. They become much more contagious, and they get better at defeating the immunity that we get from previous versions. And that's what BA.5 does. It's very, very contagious. And if you've had a previous infection or been previously immunized, you may still get symptoms. You may not get severely sick, but you'll likely have some symptoms if you come in contact with this variant.
Okay, and cases in Milwaukee are steadily climbing, and right now Milwaukee is in that high transmission category. How do hospitalizations and death rates right now compare to high transmission that we have seen before in the pandemic?
If there is a silver lining, it is that we don't see as a percent as many hospitalizations and not as many folks in the ICU as we did in previous waves. If we remember back to like Delta or even that original Omicron wave, late last winter. So that's the good news, that that's not happening yet. At the same time, we want to decrease transmission. There's a few reasons. One, the vulnerable in our communities are at risk now. If they get BA.5, they may get severely ill, but maybe even more importantly, if we slow down the number of people that this transmits to, we slow down the rate of these new mutants that are coming out, and it gives us a chance to develop vaccines that are actually effective against the variants that are out there when those vaccines come to market.
Interesting stuff. And lastly, I want to ask you this. The FDA has now authorized a new vaccine for adults called Novavax. What do we know about this vaccine, and how is it really different from the others that, of course, we hear about, like Moderna and Pfizer?
The big difference between the Novavax vaccine and the other vaccines we're accustomed to, Moderna and Pfizer, is that it uses more of an old school technology. So if you are someone who wasn't vaccinated because you were worried about the new mRNA technology that was used in creation of the Moderna and Pfizer vaccine, this vaccine doesn't do that. It's an old school vaccine. So there is some hope that some folks who were truly turned off the vaccine because of the way it was developed, the technology, may be amenable to getting vaccinated with this Novavax vaccine.
Important information. Dr. Jeff Pothof, we appreciate your time.